My name is Dr. Jules Walters. I'm a board-certified plastic surgeon, and recently I've been doing a lot of eyelid surgeries, so I want to talk about my approach and why I think it is state-of-the-art. So today we're going to specifically talk about the lower eyelid, and there's two main approaches to lower eyelid rejuvenation. There's fat reduction with fat grafting and fat transposition with fat grafting. So let's talk about each. So with fat reduction, we're making an incision inside the eyelid and actually removing the fat pockets that are causing the eyelid bags. So after we reduce the fat pockets and reduce the eyelid bags, there can certainly be some hollowing underneath the eyelid and into the cheek. And for that, we can take fat from other areas of the body, like your abdomen, your thighs, your waist, and process that fat and then graft it back into the area to provide a natural result in volume replacement. So that technique can actually be a great technique, and I utilize it in some patients, but there can be some unpredictability with the fat grafting. Sometimes the fat grafting can resorb, and sometimes because the fat has to gain its blood supply, there can lead to some fat necrosis, which means lumps and bumps, and sometimes some irregularities underneath the skin. So the other popular technique, and my most preferred technique, is to actually not reduce those bags, but to utilize those fat pockets and transpose them back down into the hollow instead of fat grafting the tear trough in the cheek area. With that, we take predictable fat with its blood supply and we're able to move it down to where it's not needed and place it where it is needed. So I think with fat transposition, the majority of the hollowness for the under eye is typically in the tear trough area. So we take that fat with its blood supply and transpose it very predictably. Many times with fat transposition surgeries, I'm also utilizing fat grafting. I oftentimes fat graft the cheek and other areas of the face to give very natural results. So in my opinion, utilizing fat transposition for the lower eyelid as well as fat grafting around the surrounding areas gives the most natural and predictable results.